Hi everyone, my name is Ashley Casem.
And I'm Sabrina Sladek.
And we are balance and vestibular physical therapists at Physical Therapy and Balance Center in Rockville, Maryland. So in honor of Falls Awareness Week, we are going to be talking to you today about balance and about fall risk and about what you can do to minimize your fall risk. So Sabrina is going to start us off today by talking a little bit about what exactly balance is.
So just a little bit about balance. It's what helps you stay upright when standing. It's also helping you know where you are in relation to gravity and which way is up and which way is down. Here's a little video on what our balance system does. A properly functioning balance system will allow humans to see clearly while moving. You can see in these videos it's a little bit difficult. It allows you to identify orientation with respect to gravity, determine the direction and speed of your movement, and to make automatic postural adjustments to maintain your posture, that upright posture. So where does the balance come from? There's different systems that help you with your balance. There are three, in fact. One is your vision. Another one is your somatosensory system, so how you feel through your muscles, your joints, and your feet. And the third is the vestibular system and the inner ear. And a picture of the inner ear. This is kind of showing us, so you can see the parts of the inner ear and the canals of your ear and the different organs, so your utricle and your saccule, and all of these help to tell you or to tell your brain where you are in space.
Okay, so we are going to talk a little bit about dizziness next, because that is something that definitely can affect your balance and can definitely increase your risk for having a fall. So the word dizzy means something completely different to everyone. So it's important to be able to describe your dizziness correctly so that your physical therapist or your doctor can help figure out what's wrong. So on the slide here, there are a few different words that describe different types of dizziness. So we're going to go through each of these. So the first one is vertigo, and this is something that probably all of you have heard of before. Vertigo basically refers to the sensation of rotation. So people that have vertigo might feel like the room is spinning, or they might feel like they are spinning within the room. So it's really that true rotational sense. And we see this a lot with disorders of the inner ear, of the vestibular system. Another way to describe dizziness is imbalance or disequilibrium. So rather than a true spinning sensation, these are people that just kind of feel unsteady. So again, they don't have that true vertigo, that true rotation or spinning, but they just kind of feel unsteady. They feel imbalanced when they're walking, when they're on their feet. We also can describe dizziness as feeling faint or lightheaded. And this really is the sensation that you might pass out. And this is something that's most commonly related to the cardiovascular system. We also have motion sick, and this one is pretty self-explanatory. This just refers to a sensitivity to movement. So you're in the car, you're on a boat, you're on an amusement park ride, things like that, and you have that sensation of dizziness and nausea. That is what motion sickness is. And then lastly, we have behavioral dizziness. And this is dizziness that is a result of conditions like anxiety. So people that have severe anxiety, it's common for them to feel dizzy. People that have panic attacks can feel dizzy. So that is behavioral dizziness.
So Ashley mentioned a few reasons of why you could have dizziness, but to kind of break it down into a few points, there's the otologic reasons, so the inner ear related, which accounts for about 50% of all dizziness. You also have central related dizziness, which comes from the brain, and that accounts for about 5% of dizziness. You have medical, which accounts for 5 to 10%, so that can be the cardiac reasons that Ashley mentioned. The psychological, which were similar to those anxiety, behavioral reasons, accounts for about 15%. And then you have idiopathic, so totally unknown reasons or diagnoses, and those can account for about 25%. So going back to it being fall awareness, we really want people to understand the risk of falling. So if you look at this depiction right here, 1 in 3 people over the age of 65 fall each year. And those account for a lot of issues. We have most fractures among older adults are caused by a fall. And in 2013, 2.5 million people had non-fatal falls among older adults, and they had to be treated in the emergency department. Every 20 minutes, an older adult dies from a fall. Every 13 seconds, an older adult is treated in an emergency room for a fall. And the biggest, falls are the leading cause of both fatal and non-fatal injuries among older adults. So the Center of Disease Control took a lot of statistics, and they showed that 20 to 30% of people who fall will suffer a moderate to severe injury, such as a laceration, hip fractures, and head trauma. Over 95% of hip fractures are caused by a fall. Hip fractures from falling, 25% will fully recover, 40% will stay in a nursing home, and 50% are dependent on a cane or walker, and 20% will die within a year. Those are some pretty dramatic numbers right there. On average, the hospitalization cost for a fall injury is over $35,000. And hip fractures are the most serious and costly fall-related fracture. So we're here to tell you how to prevent falls. We don't want you to become a statistic. We can help you increase your leg strength. We would review medicines with your doctor. Some other, you can always review. If you have over 5 medications that you're taking, you definitely want to review those with your doctor. Sometimes they can cause dizziness. Also, looking at your home and reducing your fall risks. So removing tripping hazards, adding grab bars inside and outside a tub or the shower and next to your toilet. Adding railings on both sides of your stairs, and improving the lighting in your home. We've heard a lot of falls that occur in the middle of the night when somebody is trying to go to the bathroom and they can't see. Also, wearing proper shoes and clothing, no loose fitting clothing that you could trip over, and slippery shoes, and also getting your vision checked yearly. So what can physical therapy offer? We do fall risk assessments, vestibular examinations to determine what's going on with your vestibular system. We perform BPPV maneuvers, dealing with the otoconia or the crystals in the inner ear. We do functional balance training, assistive device training. So some people may be new to a cane or to a walker, and we help to adjust that and to teach them how to walk using that. We also help with leg and core strengthening, which are very important in the somatosensory aspect of your balance. And we individualize exercise prescriptions in a safe environment. We want you to be successful in doing your exercises and safe when doing your exercises.
Okay, so on our next slide, there is a nice picture of a gentleman that has some funny looking goggles on him. And that kind of brings us to our next point about technology. So there has been so much research and so much new technology that's been developed that can help us figure out what's wrong. You know, what is causing your imbalance? Is there a problem with your vestibular system? So these goggles that this gentleman has on are a really good example of one piece of technology that we can use to take a close look at the vestibular system, because the eyes really give us a good idea of what's going on when there's a problem. So this can allow us to, you know, really develop a treatment plan that fits your needs. So things that we might do, you know, if you have BPPV, which we're going to talk more about on the next slide, we might do what's called a canalith repositioning maneuver. If you have lost function in your inner ear on one side, we might do some gaze stabilization exercises, some habituation exercises, and then for everyone, including people that just have generalized imbalance, we definitely can work on your balance. We'll work on some lower extremity and some core strengthening, and maybe some stretching if you have some muscle tightness also. So next we're going to talk about a condition called BPPV. So BPPV stands for benign paroxysmal positional vertigo. So that's a mouthful, so we'll kind of break it down and go letter by letter here. The B stands for benign, and that means that this condition is not harmful. The first P stands for paroxysmal, and that means that it comes on suddenly without warning. The second P stands for positional, which means that symptoms come on when there's a change in your head position with respect to gravity. And then the V stands for vertigo, and we've already talked about that. That's that false sense of rotation, of spinning. So BPPV is a really common condition in older adults. This statistic is pretty interesting. About 50% of dizziness in older people is due to BPPV. And in one study, they found that they looked at a group of older adults, not dizzy older adults, just older adults. And they found that 9% of that group had undiagnosed BPPV. So that's a lot. So what is BPPV? What are the symptoms? So commonly you're going to see short-lived episodes of vertigo or of imbalance, but commonly vertigo. These episodes last anywhere between a few seconds and a minute or two. And they come on, like we said before, with change in head position with respect to gravity. So when you lie down in bed, when you roll over in bed, when you sit up, they can come on if you bend forward to pick something up from the ground, or if you pitch your head back to wash your hair in the shower. And you can get a little bit of nausea. Some people will have some vomiting, but that's not extremely common. But those are the main symptoms there. So here's a nice picture that shows us the inner ear. That kind of swirly part that looks like a snail, that's the cochlea. That's what helps us with our hearing. And then the rest of it is the balance organ. So what happens in BPPV, there are these little calcium carbonate particles. That's the picture of the otoconia. They look like little rocks. And they sit inside a structure in our inner ear. And what can happen as we get older, they can fragment and come out of that structure. They can end up in one of these semicircular canals. And the reason that this picture keeps rotating is that when we move our head a certain way, like it did in the picture, those crystals can move within the fluid in the canals, and that's when we feel like we're spinning. So that's when you can get dizzy. So here is, just gonna pause this for a second. Here's a video that is courtesy of Jeff Walter, who works at Geisinger Medical Center in Danville, Pennsylvania. And this is a picture, or this is a video of what we see when a person has BPPV. So you're gonna watch his eye here. So the movement right now is just him lying down, and then watch what happens. So his eye, this is what's called nystagmus, where his eye is jerking in a certain pattern. And that gentleman is pretty dizzy. So that's what we see, and that's how we diagnose BPPV, and that's how we know where those otoconia are, what canal they're in, and how to treat it. So the office treatment for BPPV, some of you have probably heard of the Epley maneuver, and that is when the crystals are in the posterior canal. That's the most common type of BPPV. It's a relatively quick maneuver. It can take, 10 to 15 minutes or so, and it's really highly effective. This statistic says, cure rate of about 80% the first time it's applied, but really, overall efficacy, if this is done more than once or twice, I think it's somewhere around 97%. So you have really good odds of treating this successfully with the Epley maneuver if the crystals are in the posterior canal. Okay, so that's BPPV. So this slide just lists a few other vestibular disorders. We're not really going to talk about all of these. Meniere's disease, that's a really horrible disease where you have debilitating, spontaneous episodes of vertigo. Vestibular neuritis and labyrinthitis, those happen when there's an infection to the nerve that goes to our vestibular system. And you can kind of read through the rest. We're not really going to go through each of these here. Okay, so this is a short video clip. It's about 2 minutes long. This is from another physical therapy and balance center. And this basically just gives you an idea of what balance therapy looks like. So we're going to play that.
So while we're watching this video, Physical Therapy Balance and Wellness Center here at Rockville, we are outfitted similar to this video here with technology and balance systems for safe balance training. Makes it easy to be in the clinic in the outpatient setting and to be able to do, look at him, and to be able to do all these exercises in a safe environment.
So the harness system that you see on this gentleman, we have this in our clinic. It's a really nice tool. Basically, this gentleman here is kind of hooked up to the ceiling. There's a track overhead, and it kind of gives him, a really nice sense of security. It's safe. It really prevents falls really nicely. Kind of lets us work on some high-level balance things. All right.
We have a few pictures here of what we have in the clinic. So that's us here at Physical of Rockville. We have some pictures of our equipment. So here's the balance shuttle, which allows us to really challenge the balance system in with many different variables. Again, the overhead system is attached to this woman here, so she's totally safe while performing them. And then here's the overhead support system. So it's the SOS, the Safety Overhead Support System. So there's a whole track where she can go back and forth while doing the more dynamic activities here and walking.
Right, so we are, now we're just going to go into a few basic exercises that you can do at home to work on your balance and to work on your leg strength. So the first one is a sit to stand exercise, and this is one that you can absolutely do at home. All you need is a chair. You're going to sit down in the chair, and then you are going to stand up without using your hands on the chair, and then you're going to sit back down. So that's the exercise. So you would do that repeatedly, and that's a really nice strengthener for your leg muscles.
So another one we have here is the seated marching exercise. So while you're sitting in the chair, you really bring your knee up towards your chest and you alternate your feet. This is great for hip flexor strengthening and core strengthening.
And then we have some kickouts. And this is exactly what it sounds like. You are going to be sitting in the chair and you are just going to kick your legs straight out in front of you and then lower it back down.
All right, a great stretch. A lot of times it's tight and many people is the hamstrings. So we do the hamstring stretch. So you sit on the edge of a chair and you put your heel out onto the floor and just slightly bring your chest forward and down. And you should feel a nice pull in the back of your leg there. Those are your hamstrings. You hold that stretch.
Yeah, that's a good one. Okay, then we have some heel raises. Is again exactly what it sounds like. For this one, what you can do is turn a chair backwards and put it in front of you, and you can hold on to the chair for some support. And then you are just going to rise up onto your toes and then slowly lower back down.
If you want to challenge yourself a little bit, here's a single leg balance. So again, with that chair turned around, you can hover your hands over the chair just for safety. You can also put a hand down if it's a little bit too much, but you're trying to balance on that one foot. And if you can work up 30 seconds up to a minute, that would be great.
Next, we have something called a Romberg stance. So this is standing with your feet together. So that is something that can definitely challenge your balance a little bit. Our recommendation to make this exercise as safe as possible would be to do this with your back to a corner, just like the gentleman in the photo is doing. So that way, if he loses his balance backwards, the corner is going to catch him. The other thing that you can do for some extra support is have a chair in front of you, just like we did for the heel raises. So turn it backwards and have that in front of you. And then if you need to reach out and grab onto the chair, you can do that as well. So for this exercise, you would want to try to hold this position for about 30 seconds with your eyes open. And if that is something that is fairly easy for you, you can try it with your eyes closed.
Then we have the tandem balance. So in the same safety situation, you're going to put one foot in front of the other, so heel to toe. And you can cross your arms like the gentleman's doing, and that way it really challenges your balance system. And you're going to try to hold that position for 30 seconds. And you would switch and do the other leg for 30 seconds. If it's easy and you're able to do that, you can also try it with your eyes closed. So thank you everybody for watching our video. All of us here at Physical of Rockville, we look forward to meeting you and getting to know you. If you have any questions, please give us a call, 301-948-4395. Also, we have a free risk assessment going on. So a 15-minute quick risk assessment. Come on in and make your appointment. Take care.
All right, bye guys.